HealthPathways Melbourne is a collaborative online resource developed by Eastern Melbourne and Northwestern Melbourne primary healthcare networks in participation with healthcare professionals and organisations in the Melbourne region. It provides a single, easy-to-navigate platform with up-to-date evidence-based clinical information tailored for local use. Health Pathways is a resource created by GPs for GPs. However, it is as a valuable resource to support the entire multidisciplinary team. The platform covers a wide range of health conditions, procedures and services, including chronic disease, mental health, maternity care and much more. Alongside clinical guidance, it also provides referral criteria, decision aids, risk assessments, tools, calculators, all designed to streamline practice and support efficient workflow at the point of care. On Health Pathways Melbourne, there's a page for everything. User-friendly navigation, updated guidelines based on latest evidence-based practices and referral criteria, interactive tools such as calculators, risk assessment tools and decision aids, all which enhance the user experience and support clinical decision-making. Welcome to Melbourne Health Pathways homepage. Here you'll find the latest news with any alerts and pertinent information, as well as pathway updates and key references here on the right-hand side, such as the RACGP Red Book. Navigating to find the page you're after is easy. You can use a table of contents here on the left-hand side, which provides drop-down boxes. Additionally, you can use the search bar at the top of the page. Today, as we know, type 2 diabetes is one of the most common reasons for referral to allied health. To deliver best care, it's essential we're all aligned with the latest clinical guidelines. This pathway brings together best practice guidelines and multidisciplinary support tools to improve outcomes for those living with diabetes. The pathway is structured into clearly defined sections, including background, assessment, management, referral, and information, with drop-down boxes used throughout for easy scanning. Pertinent to the session today, we'll have a look at some of the management options. You can click on any of these live links and they'll take you. Advising of lifestyle changes will take us to Diabetes Australia. Ensure confirmation of registration with the NDSS, and here you'll have the registration form. Talk about optimum goals of management and also glycemic target rates. The recommended HbA1c rates. Considering smoking cessation advice. Considering fitness to drive. Consider referral too. And there you'll find a list of our multidisciplinary allied health teams. Clicking on these will take you to the associated referral pathway. Our referral pathways are private and public. Here, as you can see under Community Health Services, we can go to Eastern Melbourne and we'll find referral criteria for any of our local services. Returning back to our pathway. As we go down the page, we have our referral section, which will just take us to our basic acute and non-acute endocrinology referrals. At the bottom of the page, we have an information section, which is split into two, for health professionals and for patients. These can be an incredibly useful tool in both decision-making and patient education. As you can see, the content is relevant across disciplines and supports consistency of care and having a shared understanding that helps ensure patients receive coordinated evidence-based support. I encourage you to use this pathway not as just a reference, but as a daily support tool. And don't forget, you can also use the built-in CPD reporting tool. Add learning notes from your session, saving the details, and then you'll have an opportunity to create your own report. It's a quick and easy way to track your professional development. The Dementia Directory aims to provide a comprehensive listing of dementia-specific services and resources available throughout our regions. It includes information on healthcare professionals, support organisations, facilities, and other relevant services. By using the Dementia Directory, users can search for services and resources based on their location and specific requirements. It's a valuable tool for individuals and families who are seeking dementia-related support and information services. HealthPathways Melbourne is available to general practice teams and other clinicians within the Eastern Melbourne and Northwestern Melbourne primary healthcare catchments. We've recently transitioned to personalised accounts for improved online security. However, creating an account is quick and simple. Simply scan the QR code, or you can visit us at melbourne.healthpathways.org.au. If you have any questions, please email the team on info@healthpathwaysmelbourne.org.au.